are the team leader for the Neonatal Resuscitation Unit at the hospital. The labor and delivery team is preparing Dr. Stone's patient for delivery, and you are meeting with Dr. Stone to discuss the upcoming delivery. The patient's membranes have ruptured, and her cervix is dilated to 9 centimeters. 1. The 4 pre-birth questions the team must answer include all of the following except A, B, C, D, correct answer, B, gender of the baby. Although this might be important to the family, the gender of the baby is not one of the pre-birth questions to determine the possible need for resuscitation efforts. Dr. Stone reports that the amniotic fluid is clear and the gestational age of the single expected infant is 34 weeks. Based on this information, you know that the delivery might require a resuscitation team based on gestational age. 2. The optimal gestational age range for a term delivery is A. 28 to 32 weeks, B. 32 to 36 weeks, C. 36 to 41 weeks, D. Greater than 41 weeks. Correct answer, C. 36 to 41 weeks is the expected gestational age range for a term delivery. You asked Dr. Stone if there are any additional risk factors for this delivery. He reports that he was on call for the emergency department when the woman arrived. She does not have a regular obstetrician. The mother's blood pressure has been 182/84 today. The ultrasound showed the fetus was head down in the uterus. The mother received a dose of Demerol in the ED before being transported to labor and delivery 2 hours ago. 3. All of the following might be risk factors for this delivery except A. The confirmed head-down position of the baby in the uterus, B. The dose of Demerol in the ED, C. Maternal blood pressure, D. Lack of prenatal care. Correct answer, A. The desired position of the baby for delivery is head down, so this would not be considered a risk factor. Lack of prenatal care, maternal hypertension, and narcotics within 4 hours of delivery may all be risk factors for this delivery. As the team leader, you prepare for possible resuscitation of the infant at birth. Dr. Stone says he expects the delivery will happen in approximately 1 hour. 4. At this time, you know that the most important task you must do is A. Assemble the resuscitation team in the delivery room, B. Verify that all resuscitation equipment is present and in working order, C. Sit with the mother until it is time for delivery, D. Prepare the family members for the delivery. Correct answer, B. Verify that equipment is present and in working order. It is too early to assemble the resuscitation team. As the leader of that team, it is not your role to sit with the mother or prepare the family for delivery. You must be ready to handle an emergency resuscitation. As you are checking the equipment, you note that there is a radiant warmer that is being preheated, a bulb syringe and meconium aspirator, an oxygen flow meter set to 10 liters per minute, a positive pressure device, a pulse oximeter, endotracheal tubes in size 2.5, 3.0, and 3.5, and a working laryngoscope with size 2 and 3 straight blades. 5. You know that all of that equipment is correct except A. An oxygen flow meter set to 10 liters per minute, B. A positive pressure device, C. Endotracheal tubes in size 2.5, 3.0, and 3.5, D. A working laryngoscope with a size 2 and 3 straight blade. Correct answer, D. A working laryngoscope with a size 2 and 3 straight blade. These blades may be too large for the newborn. Instead, you should ensure that a size 0 and a size 1 are available. 6. As you assemble the resuscitation team prior to the birth, you know that the most important skill when attending a high-risk birth is A. Chest compressions, B. Defibrillation, C. Positive pressure ventilation, D. IV catheterization. Correct answer, C. The ability to provide positive pressure ventilation is the most important skill when attending a high-risk birth. For most of these births, managing the airway and ventilation will revive an infant, since most arrests in this population are respiratory.